For smooth initiation of voiding, synchronization between the pelvic floor muscles and the bladder and urethra is essential, and if this synchronization is disrupted, various types of voiding dysfunction can occur. In this study, real-time MRI was used to analyze differences in the pelvic floor muscles and the prostate movement during voiding between patients with normal voiding and those with voiding dysfunction. High magnetic field MRI now enables rapid imaging with high resolution and depicts changes in morphology, including movement of striated muscles such as the pelvic floor muscles surrounding the bladder and urethra during voiding. Using real-time MRI during voiding in males, Hochoglu reported movement of the prostatic urethra towards the rectum. A study by our group also showed that, during voiding, the bladder neck descended and the prostate moved towards the rectum with rotation. The yellow lines are the urethra. The left picture is before voiding, and the right picture is after initiation of voiding. At voiding, the posterior urethrovesical angle increases. The prostate rotates and descends towards the rectum, and the shape of the membranous urethra becomes that of a smooth curve. During descent of the bladder neck, the ventral side of the prostate contracts strongly. The anterior fibromuscular stroma, as reported by McNeil, extends from the bladder neck as a continuation of the trusor muscle, covers up to the prostate apex, and consists of a smooth muscle. This study included 11 male outpatients evaluated for a chief complaint of difficulty voiding urine between August 2012 and April 2013. 3 volunteer subjects with normal voiding were also included as controls. 14 males underwent real-time MRI in the lateral position during voiding. In the normal control group, the mean age was 31.6 years, and mean prostate volume was 17.2 milliliters. In the voiding dysfunction group, the mean age was 70 years, and mean prostate volume was 36.7 milliliters. All patients in the voiding dysfunction group were taking an oral alpha-1 blocker. Contraction of the anterior fibromuscular stroma at the initiation of voiding was significantly greater in the normal group. As age increased, contraction of the anterior fibromuscular stroma decreased. The movies show the contraction of the male pelvic floor muscles during micturition. The red arrows are the urine flow in the urethra. As seen from the transverse plane, the apex of the prostate moves towards the rectum. When seen from a sagittal view, the apex can be seen descending and rotating. The pubococcygeus muscle, which is a part of the levator ani, changes its shape from an arch to a reverse arcuate with contraction. Though the posterior urethrovesical angle increases, the anterior urethrovesical angle does not change. The movie shows the urine stream from the bladder lumen to the urethra. The stream looks like it rotates in a spiral clockwise direction. The deformation of the morphology of the bladder neck and urethra due to contraction of the anterior fibromuscular stroma and pelvic floor muscles favors the spiral urine stream during voiding. This deformation decreases the flow pressure. The left movie is that of a normal young male, and the right movie is that of a patient with prostate cancer who has difficult urination. There is no movement of the bladder neck and urethra during voiding in the prostate cancer patient. This movie shows voiding of a normal male, a BPH patient, and an elderly male. In the BPH patient, the movement looks difficult because of the large prostate size. In the elderly male, the bladder neck position has already descended before micturition. The motions of the bladder neck and prostate are weak. The present results indicate that strong contractions of the pelvic floor muscles and the anterior fibromuscular stroma are important for normal male micturition, since the bladder neck and urethra are deformed to a shape with no stress that allows for smooth urine streaming. We suggest that pelvic floor muscle relaxation and no contraction with aging or other reasons can worsen male voiding function.